All right, so today we're going to talk about the three biggest mistakes I've seen this week people do, real people losing real money and benefits out there. All right, so my name is Ed Weir, a former manager of the Social Security Administration. In my kind of semi retirement, I help people throughout the country make sure they get all the benefits they're entitled to: Social Security, retirement, disability, survivor benefits, Medicare, Medicaid, the Affordable Care Act, all the above. So I do this live Q&A pretty much every day recently. I've got over 400 videos. I do a bunch of videos every week, trying to get the information out there so you, your family, and friends can get everything they need and entitled to and eligible for and earned. But I'm seeing too many mistakes out there, way too many mistakes. So I'd figure I'd come up with this kind of new series of every week. I'll give you all real people losing real money. So let's just jump right in it. Make sure you subscribe and like and do all that kind of good stuff so more people get the information, so people stop making these mistakes out there. All right. So I talked to a gentleman, 71-year-old in Florida, and he hadn't even filed for benefits yet. And hopefully everybody, well, obviously not everybody, but please reach out to your family, friends, aunts, uncles, grandma, grandfather, all those people out there. Um, your Social Security benefits do not increase after 70 years old based on any delayed retirement. So you get delayed retirement credits from your full retirement age up until 70 years old, and then they stop increasing. Yes, I've done a video on how your benefits can continue to increase in your 70s, 80s, 90s. COLA, obviously, if you continue to work and to pay into Social Security, they increase. And there's, other ways, but watch my video on that. But in terms of, waiting, you file early, your early retirement at 62, your benefits are reduced about 30%. You wait until your full retirement age, you get the full amount. If you wait after that, from your full retirement age to 70, you get an extra 8% per year. So this gentleman, he's going to get a 24% increase over his full benefit amount, but he could have gotten that over a year ago. His birthday, I think he said it was in March. So he lost about a year and 3 or 4 months of benefits. And he hadn't even signed up for Medicare yet. So he's going to get essentially a 60% Part B penalty for the rest of his life. So because he just didn't know. So I told him to immediately call Social Security. And I think hopefully we saved him some money, because there's a protective filing. I guess last year he had actually tried to reach out about September, still 6 months late, but he tried to reach out to his local Social Security office there in Florida. And they told him, you can't come in, you have to do it online. And he wasn't very savvy on the line, so it took him forever to file online. And so that is a protective filing. So he called back in September. Social Security in September completely dropped the ball. So what I told him to do is say, okay, when you call them up, I don't do it online because this is a special situation now. Call them up, demand an appointment. If your local office won't give you an appointment, then call another office. You don't have to go to any particular office. I ran the third busiest office in the country. One of the reasons it was the third busiest office in the country is there was two other offices in our city, and we had better customer service. So people used to come to us, and therefore we became one of the busiest. So you can go to any office you want. So if you don't like that office, go to another office. And so I told him to go to that one or another office and, schedule the appointment, get a phone appointment, and then say, hey, I want to start my benefits. I want to start my Part B. And I want it to go back, protective filing, open lead back in September. And after your full retirement age, you can actually go 6 months retro. So September, go back to 6 months. So that might be able to get him his all his benefits back to 70 rather than losing that entire year. And because they should have started it 6 months prior to his open lead protective filing, therefore he will also be able to, hopefully, if they do everything right. I told him, come back here, and if they didn't, and we'll come up with Plan B. And that should eliminate at least a year or 2 years of Part B penalty. So they should be able to start it at that time. So yeah, so if he would have just kept going on, he could have got, 70% penalty, 80% penalty, and lost all those benefits. So hopefully we were able to find him a lot of money. And again, it wasn't me that found him money. I just do these crazy videos all the time. And it's y'all who share and subscribe and like that get these videos out to people. So he got this extra money because y'all did your thing. Another individual called from overseas, and a husband and wife, and they've been living overseas for a couple of years, and they were under the impression that if they stopped Part B, because they already started it, that they would also lose their monthly benefits. And I said, no, 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 no. You have to have Part A, in order to receive monthly benefits. You can't stop that, but that's free, unless there's, as I always say, there's always exceptions, exceptions, exceptions with everything Social Security. If your Part A is not premium free, you can stop it. But most people, Part A is free, the premium anyway. But in terms of Part B, they're living overseas. He was born and raised in that particular country, and he said, yeah, he's never come back to the United States. Because I always tell people that go live overseas, they go live overseas, and they say, I'm just going to stop Part B because I'm never coming back. I'm like, well, have you ever lived in that country for a long period of time? How's the political situation? Are you ever going to get sick and you think you might have to come back? And so I always say, really, really think hard and long about canceling Part B. But this particular case, yeah, it's, never, never coming back. But they were paranoid to stop Part B because they thought that would stop their benefits. So they have lost a good $6,000-7,000 over the last couple of years paying Part B when they didn't need to. So they're on the phone probably right now, calling and canceling Part B and saving tens of thousands of dollars going forward. So yes, stopping Part B does not stop your benefits. Stopping A, which you really can't do. But that's I'll talk about that in a future mistake video in terms of HSAs. There's so many. I just, when I started figuring out this series, I started writing down some of the mistakes that common mistakes, and yeah, there's hundreds of them. People are losing way too much money. All right, another lady this week, happens all the time. Divorce decree. She'd been walking around just on her own benefits, and she was entitled to more benefits on her ex-husband, so she was married to for 10 years. And she's not married right now, but in the divorce decree said that she will not get the husband's 401k or the dog or the car or the Social Security retirement benefits, spouse benefits. And first three, okay. The Social Security benefits, no relevance whatsoever. When you go into a Social Security office and they ask to see, ask for you to prove 10 years marriage. I've done hundreds of thousands of these. We look at your marriage certificate, look at the names, the date of marriage. We look at the divorce, plaintiff, defendant, day of divorce, and that's it. We don't look at anything else. So it might be a divorce, 20, 30, 40 pages. We just look at those three things and nothing else. So she has been walking around for 2 years missing a lot of money. And so now she has a appointment scheduled to get that money. And remember, even if your ex hasn't filed yet, I'll add this one to another future mistake, but I want to make sure I get this out there on a daily basis. I think your ex doesn't have to have filed. If they're 62, you can file regardless if they have filed or not. Okay, so those are the three biggest mistakes I've seen this week that have lost the most money for people. And so this is also going to be a Q&A. So if you're just watching this video for the three, then have an awesome day. If you have any questions, just go ahead and type them in the chat, and I'll be around here for another probably about 45 minutes, and I'll answer all your questions and all things Social Security retirement. And if you're looking at this video and say, this video is an hour long, no, the three mistakes are about what I did it in 9 minutes. But the other 50 minutes are Q&A from people. So let's see what we got here in terms of questions. And the first one is a comment. Dr. Ed, so grateful for you and a broker, Nick, Nick just helped me choose a new Medigap plan company. I was approved and I'm the happiest person alive right now. Thank you so much. All right, good deal. All right. So yeah, I've put together a network that people that can help you nationwide with all things Medicare supplements, dental vision, even burial insurance, Medicare Advantage, and I also just added a Affordable Care Act, Marketplace, Obamacare network as well, because there's just too many people doing the wrong things out there, too many shady organizations and agents and brokers. So I figured I'd just do it myself, right? So I put together a team to help you out. Let's see here. Just Jeff. What's up, Just Jeff? Let's see what we got. What happens when somebody on SSI only has 38 credits and then hits fraud? Do all benefits stop? I ask because I've heard you explain often that once fraud begins, all disability benefits stop. All right, no. If you've only got 38 credits, that means you're not insured for regular Social Security disability insurance, and that's the one that switches. It stops, but it doesn't. Your disability benefits stop, but you still continue to get a check. It's just no longer called disability. Now it's called regular retirement. So you don't have any CDRs and work requirements or anything, work limitations. But if you're just receiving SSI because you don't have enough quarters of coverage, then no, you continue to get SSI as long as you're disabled, and because SSI is a welfare-based program, as long as you don't hit a $1 million lottery. I heard there's a $3 million lottery check out there that hasn't been cashed yet. So just Jeff, go check your cupboards. That might be you. All right, let's see. My husband receives a pension from his employer and they didn't pay into Social Security, but for 25 years, his former employer did pay into Social Security. Is he entitled to receive Social Security from that job? Yes. So he worked for a city, state, or local government that did not join the Social Security program. They opted out of it. And there's about 4 or 5% of American workers that have that type of thing. But yeah, if he ever worked at a job that paid into FICA, then he is, yes, entitled to FICA. But the estimates you see if he goes on to ssa.gov, my Social Security account, set up one of those are don't take into consideration the non-covered pension that he will receive. And it'll say right there in bold letters, if you are receiving a non-covered pension, this calculation is not correct. So you have to actually go in there, and he has to provide what Social Security calls a WEP letter. And so tell him to schedule an appointment, get his money as long as he's 62, and work limitations, not working, earning over the annual earnings limit, and all that kind of good stuff. But schedule an appointment and get a WEP letter. Just call your HR, and they'll know exactly before you even say WEP. The second word, they'll know exactly what you're talking about. It's basically a letter from the place that he's getting that non-covered pension that says when you're first entitled to that pension, when you were first eligible for that pension, and how much it is on a monthly basis. And Social Security will need that to give him his calculations. A teacher in Texas cannot collect Social Security, but then the husband passes away. Is she entitled to his Social Security? Signed, Bookworm. Yeah, so it sounds like same situation. It's a WEP, a GPO type thing. A teacher in Texas cannot collect Social Security because they worked under the Texas Social Security system. The Texas what are they, TRS? Yeah, they worked under the Texas system, and therefore they didn't pay into Social Security. It's like, if you're getting, you cannot, if you have an accident, you cannot collect money from Orange Auto Insurance Company because you never paid into Orange Auto Insurance Company. So same type of situation. If you never paid into Social Security, yeah, then you're not going to get it, nor is a spouse. Happy belated Father's Day. All right. Thank you. Fra at 67, retiring at 66, have HSA, but going to cancel and take MC at 66 and next year at 60. How if doing that, do I start Part B without getting Social Security yet? Okay, so all right, so HSA, yeah, you have to stop an HSA 6 months before you start your Part B. And then, yeah, if you just want Part B, Part A and Part B to go ahead and start, then you just go ahead and call Social Security and tell them you just want to start Medicare. And then you'll contact them later to start the actual benefits. No problem whatsoever. Done hundreds of thousands of those too. You can do it online too. It's a restricted Medicare only claim. And you just put in there that, no, I don't want my money to start. I'll contact you later when I want my money to start. Question on a particular company. Yeah, I avoid talking about particular companies. I don't want. I want to stay neutral. So it really depends on your particular what company is the best. There is no best company. It depends on your particular area, your particular doctors, prescriptions, your needs, your health, and all the rest of it. But I do, recommend particular plans, Medicare Plan N, the Medicare Supplement Plan N, super, super, super close behind Medicare Supplement Plan G. If it's in your budget, those two. If you don't have a budget for it, then Medicare Advantage all day long. And, can't spend lottery tickets, so no one is late on the count. All right. Will they just bill me monthly for Part B? Well, not monthly, but they'll do it quarterly. Every 3 months, you'll get a bill for Part B. Let me see. I am working now, but I know I cannot get my Social Security until next year when it's earned. Um, when it's earned. So yeah, if you're working, remember there's the annual earnings limit and then there's the monthly. So we're talking about early retirement here. So if you're working right now, but you stop working, halfway through the year, then Social Security doesn't look at what you earned before you started benefits. So if you want to start your benefits in August because you're going to stop working or reduce your earnings, then they don't care what you made up until July. You could have made $1 billion from January till July. Social Security doesn't care. They only care about how much you're going to make starting in August. And it goes to the monthly. This year it's $1,860. So the first month you go under $1,860 and stay under that amount, then you can get your benefits. No problem whatsoever. And next year you have to stay under the annual for the entire year. Can I get spousal benefits? Yeah, same exact situation. So retirement, spousal benefits, survivor benefits has the same exact work limitations, the annual earnings limit and all that kind of stuff, monthly, annual, whatever the case may be. But what if you have your 40 credits when you worked as when you were younger? Not exactly sure what that question is. Can I collect from two husbands at the same time? No. You can collect from the highest one. Can you receive Social Security and disability at the same time? Disability is Social Security. So SSDI is Social Security. So you probably mean retirement. No, but you can receive Social Security spouse benefits and disability at the same time. You can receive Social Security surviving spouse benefits and disability at the same time. You can receive Social Security disability insurance and SSI at the same time. Yep. I'm new here. What should one consider when thinking of retiring as far as SSI? SSI is the welfare based program. You probably mean regular Social Security. Yeah, if considering thinking of retiring is, the earliest you can collect retirement benefits at 62, it's reduced, 30% from your full retirement age. The longer you wait every month, you don't have to wait an entire year to get that increase. People think they have to wait till their birthday or a full year. No, every single month you wait, your benefit goes up a little bit before your full retirement, even after your full retirement age until 70. Your benefit goes up a little bit every month. So if you're, again, the work limitations are there, and whether it's a monthly or yearly. How does disability work? Yeah, if you're disabled and you're unable to work, Social Security defines disability as the inability to work because of your disability. And your disability has to last 12 months or longer or end in death. So yeah, if you're disabled and you're not working because of that disability, and you can work a little bit, it's called substantial gainful activity. If you're under $1,550, then and you're not able to work anymore because of your disability, then file. But the first thing you should do is watch the 3 or 4 videos I did on disability. I did 4 videos about a month or so ago. So go to my YouTube channel, click on the videos, not the live portion, but the videos portion, and you'll see the 4 videos there on disability, on everything. It explains all the tips, tricks, and secrets. Medicare will no longer cover medical supplies. Does Medicaid pay for it? Yeah, Medicare covers medical supplies, but they're definitely cutting back on a lot of things. All right, let's see here. What other kind of questions? Is there a function report that I can bring to my doctor tomorrow to fill out and submit to Social Security to help my case? Um, yeah, usually doctors don't really like filling out forms. You know, what will happen, you can, have them, write something up, type something in kind of free form. I'm sure, doctors have some, boilerplate type of thing that they usually prefer. Um, and, tell them, hey, can you write up your boilerplate and says, hey, John Smith is unable to work because of, and then writes a sentence of what your disability is. And that's the way it's nice and succinct. But the when you file for disability, you will give Social Security all your doctors and your hospitals and clinics, and Social Security will get all the medical records. So one little form or letter or something like that is not usually sufficient. It's the totality of the documentation that's important. Edward, my sister suddenly passed away at work last week at age 60. Wow, wow, sad. What survivor benefits are her 3 children, age 19 to 22, entitled to? Oh, yeah. Unfortunately, none, because children have to be under the age of 18, um, or unless they're still in high school. So the 19-year-old might, if they're still in, but probably 19 years old, probably. If any of the children are disabled, and became disabled before the age of 22, then they can get, possibly get benefits. But other than that, yeah, it would only go to the spouse unless one of the children is still in high school. Can my husband, who receives a pension from a company that didn't pay into it, gets a small pension amount of 600, and I receive 8 as Social Security, can he get an additional 300? Yeah, that'll be, if he didn't pay into Social Security, that's a government pension offset, GPO. So 2/3 of whatever he receives from that non-covered pension will offset whatever spouse benefits he's entitled to. So I would file, and I'm not sure the numbers and how much he's receiving and how much he's entitled from your record. So tell him to call, schedule an appointment, file for spouse benefits. And again, you'll need that WEP letter, a GPO letter now, I guess. First entitled, first eligible, and how much the benefit amount is, and they'll be able to do the calculations and tell you whether he can get any more money. If I have my insurance from my city job, do I have to cancel my Medicare because my Social Security is very little and 174 makes it work? Yeah, if you have health insurance from current work, and your employer has 20 or more employees, I guess your city, I'm sure it has 20 or more employees, unless it's the city I grew up in. Yeah, you can call up and cancel, Part B and say, hey, I've gone back to work and I've got my health coverage from work and all that kind of good stuff. Yep, you can actually do it. And then once you stop receiving health insurance from current work, then you go ahead and sign up for Part B and there's no penalty. Let's see what other kind of question. Medicare. Okay, wait a second. Can I get widow's pay and my own Social Security? Yes, but one offsets the other. So if you're entitled to $1,000 from widow's benefits, and you file for retirement benefits on your own, and those are $700, then you'll continue to get $700 from yours, and then $300 from widow's benefits for a total of $1,000. But if you're thinking about doing one or the other, here's what I would check out: is file for widow's benefits, surviving spouse. It's all the same thing. File for those, or check out the numbers and find out how much the surviving spouse benefits are, and then find out how much your retirement benefits are. And if your surviving spouse is about the same or even less, I would even take the surviving spouse and let yours increase, depending if your age, if you're under your full retirement age, even if you're under your full retirement, even at your full retirement age, because yours can continue. Don't touch your benefits. Let yours continue every single month all the way up to 70, or your full retirement age, 67, and then collect your survivor benefits. Don't touch yours. Let yours increase, and then next year, 2 years from now, 3 years from now, 4 years from now, jump on over to yours when yours is the amount you like. Yeah. Let's see. Lisa Simplified. So sorry to hear about your loss of your sister. So tragic. Yeah. What an awesome community we have here. Hi, everybody. Hit that like. Thanks for getting good information. All right. I like it. Let's see what else we got here. Do the veterans pay me as a caregiver for my husband? Yeah, I've heard. I'm not a veterans expert. I'm ex, Marine Corps sergeant, but I never worked for the VA. But yes, I've heard that they do have, the Veterans Administration has a program like that. That if you're taking care of a vet, and they have something, so I would definitely call the VA. One day I'm going to add, once we get big here, and then I'm going to add somebody that does VA. Disabled, so parent filed the last 3 months. However, Social Security claims they do not know how to enter this information into the computer so parent can get paid. Disabled, so parent filed the 3 months. Not sure. Yeah, I'm sorry. I'm not following that. All right, LH became a member. Thank you, thank you. So yeah, so the member, silver member, yeah, it helps out the channel. So a lot of people subscribe, and awesome, appreciate it. That helps get the word out. But some people also click the little member thing and support the channel as well. So, can you get SSD and SSI, or only one? You can get both. Yep, you can get both. But the most you can get on SSI is this year is what, $943. So you can get, if your SSDI is less than that, say for instance, if your SSDI is $800 and you have no other income or resources, then you can get an extra, what, $143 from SSI. So yep, you can get both. Do you think WEP will ever be eliminated or repealed? No. Because if it ever is, then there's going to be the other 96% of Americans and say, hey, how come I don't get 90% replacement rate on my Social Security benefits, like, Texas teachers or Chicago teachers or LA firefighters? How come they get a 90% replacement rate for their benefits, but the rest of the country, the other 96% of the country, only get a 43% replacement rate on our average index monthly earnings? That doesn't make sense. That's not fair. So yeah, you would have a massive uprising. My husband has a state job with pension. He has paid in Social. Okay. And they give him less because of pension. No, they don't give him less. They just correct his benefit amount. Watch my video on the WEP challenge, and nobody has challenged me. I put it up there and I says, okay, here's the WEP challenge. All you, people are like your WEP and GPO out there. Here's the gauntlet. I throw it at you, and nobody has challenged me at all. 0 challenges. So, is there a set cost for Part B, and does it depend on a particular insurance company? No, Part B is not through an insurance company. Medicare Part B is directly from Medicare. So Part A and Part B, you sign up directly with Medicare. Medicare Advantage plans, Medicare supplement plans, prescription drug Part D, as in David, those are through particular insurance companies. And yes, they are priced based on those insurance companies. Medicare supplements were the ones I recommend because there's no, pre-authorizations and networks, unless I did a video a couple of days ago and when you should not get a Medicare supplement, like if you have Medicare or Medicaid or TRICARE, federal employees health benefits and stuff like that. But yeah, so those premium for that, Medicare Advantage, a lot of those have 0 premium. Now I'm going to do a video later this week about the big changes in Medicare Advantage. So I think possibly the the beginning of the end of Medicare Advantage as we know it. So, uh, I get workers' comp and SSDI. My SSDI is offset because of it. If I stop workers' comp, how much will it increase? Yeah, it really depends on how much your workers' comp is and everything. It's a calculation. Basically, what it is Congress decided that if you become disabled, you shouldn't really make more money in while you're disabled than you did when you actually worked. So what it is that um, if you're getting a pension from a workers' comp from a public disability benefit, so it's not like a private, company workers' comp type thing or long-term insurance or something. It's from a public state, local county public workers' comp, and you're getting X amount of money, and you're getting X amount of money on Social Security disability, and that's together, that's more money than you ever made working. So that's where the offset comes in, and not sure how you could stop that other one. Some people try to take says, well, if I don't get it monthly, I just take it cash out, then I won't get offset because I cashed out. Now, Social Security then calculates that over your expected lifetime, and you might have to, you might actually lose more. Yeah, a lot of people. I'm gonna have to add that to another one of people make mistakes on. So. Is her ex-husband who left her and the kids with little support for another woman entitled to her benefits? Yes, I think we had someone here yesterday that didn't pay child support, and then he went in and filed for benefits and then filed for spouse benefits on her record. Yeah. So, but she is now going to go to the court and get a garnishment because he was hiding, his work. He worked under the table for however long, so she could never get alimony or child support. I forget which one it was. But now that he's getting federal benefits, that's easy to garnish those wages. So she's going to go back to the court and, yeah, get that money. To piggyback what you asked, well, I also have to purchase Part D with Part B. It depends. If you get a Medicare Advantage plan, most Medicare Advantage plans come wrapped up with a Part D plan. If you get a Medicare supplement plan, then yes, you also have to get a Part D plan, and those you get through private companies. Yes, and a lot of people are losing money there too. Is when they sign up at 65 or whenever for their Medicare supplement plan, and they say, well, they tell the agent or broker and says, I don't need, I don't take drugs, so I don't want to get Part D. And the agent or broker is lazy because they really don't make money on Part D. So they say, okay, all right, fine, be that way. And they just go on. And what they should do is say, okay, you understand you don't take drugs, but you understand, if you ever do next year, get cancer treatment and have to do it, whatever, then you're going to have to pay all that out of pocket. And when you go sign up for Part D, you're going to pay a 1% penalty for every month you did not have Part D when you were supposed to. Part D is in David, the drug plans. So, yeah. Why do you think it's the end of? Yeah, I'll talk about that. Not the end. Well, the end. Yeah, I'll talk about it in a couple of days. So make sure you come on back. It's definitely the end of those as we know it in terms of all of the super goodies. Yeah, it's going to be completely different than it was. If you're receiving, but okay, if you're receiving benefits, but you receive an inheritance, like the inheritance insurance, does that count against? And let's see. Inheritance does count against SSI, the welfare-based program, because it's a welfare-based program. But everything else it does not count against. Doesn't count against retirement, survivor benefits, spouse benefits, SSDI. So, yep. My son is autistic. What are the benefits and or how does it work? Okay, so if you have a child, disabled adult child or disabled child, then absolutely file for disability benefits. If you're not receiving benefits, they can file for SSI benefits, but if that child is living with you, your income and resources are taken into consideration. If you are already receiving retirement or disability benefits, you can add that child as a child, disabled child or a disabled adult child, and they can get, 50% of your primary insurance amount. So yes, file and watch my 4 videos on disability. And the sooner the better, because yeah, it's taken forever to get disability claims approved nowadays. All right, let's see. Thankfully, I don't take meds either, but thanks to you and your channel, I know it's firsthand. Okay, awesome. Yeah, yeah. People say I just don't like, and there's a lot of plans this year. There's some plans out there that are like under a buck, 50 cents, zero premium per month for the Part D plan. I think those are definitely going away next year because there's a bunch of changes in the Part D, uh, uh, financial changes that I think those are going to go away. But we're not 100% for sure. We'll know in October. So if you want us to review, like I've said, this is 2025 is going to be the biggest year, in a long time for all of the changes for Medicare Advantage. Medicare supplements, once you get those, you're good. Unless you get a G and you want to save some money and go to an N, then, call me up, email me, and I can have someone that's licensed and contracted in your state to reach out to you and give you all your options. But Medicare Advantage, um, yeah, you got to change. You got to check it this year. You have to review it this year. If you haven't reviewed your plan in years, this is the year to do it. Insurance companies are hoping you don't, so they can sneak those changes, um, so they can make more money and make up for the money they're losing in other places. So yeah, this is the year. So if you want us to reach out to you in October when the new plans come out, email me and say, hey, I live in this state. Here's my name. Contact me in October, and we'll put you on the list in October and review your plan. And if it's the best one for 2025, then you don't do anything. You just keep on keeping on. But if your company has come out with a new plan or another company's come out with a better plan, we'll give you those options. And then you decide what you want to do. If you don't like it, then you don't like it. If you like it, then we'll get you all set up. All right. If they automatically deduct Part B and Part D from your Social Security check, how can you pay for Part B and Part D from your HSA? Yeah, you can't pay it from the HSA. Yeah, it has to be done. If you're receiving, I'm sorry, I was a little delayed there. Uh, yeah, yeah, you can't pay it. You have to pay it through your Social Security check. So, I mean, I guess you can make other arrangements and, have the HSA reimburse you for the Part B. Um, yeah, so. And amount of years and age, the primary insurance amount is higher for those cohorts. Why are those unfortunately born and penalized? How could this be correct? Yeah, I'm not. Yeah, I've heard that before. I'm not sure. Yeah, it's your primary insurance amount is based on your average indexed monthly earnings, indexed for a wage index, and then multiplied by 3 different bend points, and those change every year. All right. How much can I make working and qualify for my husband's survival benefits? $22,320 this year. As long as you're under that, you can continue to receive survivor benefits. Um, and that's if you're looking at full retirement age. The year you reach your full retirement age, then you can make what, $59,520 the months before your full retirement age. So anything over that, so if you make $1,000 over that, you can still collect your husband's. It's just that they will hold back $500 worth of checks. How do they do that? Is, well, they don't know you made $1,000 over until you actually file your taxes. So once you file your taxes, they will look and they'll say, "Hey, you made $1,000 too much. You owe us $500." And at that time, you can say cut a check, or you can say, yeah, whatever. Can I set up a payment plan for 12 months or 24 months or 60 months? And then just pay it back. And there's no interest. So there's that. Yeah, HSA can't be used for premium payments. Yeah. Yeah, I'd have to have them reimburse you. Yeah, yeah, you can't use it for the premium. Definitely Part B. I don't know about other private insurance companies whether they can do that there, but definitely not for Part B. But I'm sure there's a way you can configure. I don't know. I would reach out to whatever HSA you have and say, hey, I paid 174. Can you reimburse me? Because I know you can't pay it directly, but can you reimburse me somehow? I don't know. Yes, calculated that on SSA Tools site, very accurate. 1960 is 100 less than 1961. My record. Okay, yeah, it's probably yeah, the how they calculate the Amy, the bin points maybe for that year. Let's see. Will my SSI increase when I turn 65 or stay the same? SSI, that's a welfare-based program. This year it's $943 of the max you can get in SSI. And yeah, if Congress increases SSI, the welfare they do every year, then you might be able to get like 1,000. So no, it'll stay the same. SSI only doesn't change based on you turn 65. It changes based on what Congress decides. It's basically a COLA type of increase. But this year the max you can get is $943 on SSI. Parent filed for claim for disability, but Social Security claims they don't know how to pay it out. Yeah, I have no idea. Yeah, I've done hundreds of thousands of claims. So I don't understand. They don't know how to write a check. They don't know how to do direct deposit. Yeah, that makes no sense whatsoever. Yeah, you need to. I probably the person. Yeah, that makes zero sense of what they said like that. They haven't done the final calculations. I could see that if there's a SSDI and SSI offset because you received SSI first, then they just have to, those two departments have to talk to each other and do the offset. So yeah, the whole thing, they don't know how to pay it out. That makes no sense whatsoever. I would contact an operations supervisor in that particular office and they'll tell you why they haven't paid it out yet, but that's not a reason for them not paid out. That makes no sense. 63 now on SSDI. When I hit 67 retirement age, does my check stay the same? Yes. When you're on SSDI, yes. Yep. It'll just switch from disability benefits to retirement benefits, and you will no longer have CDRs or work limitations. You're just going to be receiving regular retirement benefits, but the check will be the same. Pay date will be the same. Everything will be the same. It's a bureaucratic thing. They stop taking your money out of the Social Security Disability Trust Fund and start taking out of the Retirement Trust Fund. So again, it's actually good for you. No more CDRs. Life insurance benefit doesn't count for IRMA. Okay. Yeah, unless it's like an annuity and you're taking out of an annuity and that's income, but no. When I turn 65, will I go off SSI and onto Social Security? Okay, no. SSI is a welfare-based program. So if you go on disability before retirement, the judge grants you Medicare and Medicaid. Well, the judge doesn't. If you're on disability for 24 months, then Medicare automatically starts. The judge has nothing to do with that. So if they determine that you became disabled 2 years ago, then your benefits, your Medicare starts next month. Not Medicaid, Medicare. Medicaid is you have to go down to the state agency and apply for Medicaid. That's a welfare-based health insurance system. Remarried 3 days before 60th birthday, was refused access from Social Security. Yeah, you can't remarry before 60. What do you think it's harder to be approved for disability? Why do you think it's harder to be approved for disability benefits? Harder than what? Yeah, disability, that it's, it depends on your disability, whether it does in fact keep you from working. So what is the WEP letter from an employer? Just a letter that says, when this person was entitled to the non-covered pension. It's from an agency that that person worked for that didn't pay into Social Security. They work for a city, teacher, firefighter, cop, or something. And it just says when that person first became eligible for that pension, when that first person was first entitled to that pension, and how much that pension is. I was born in 63 and I'm still working with disabilities, no pension. I don't think I can work to my full retirement age. What will be the best approach for me? Yeah, if you can no longer work because of your disability, then yes, absolutely file for disability. If your disability is going to last 12 months or longer, and it keeps you from working, then file for disability. What you can consider also is what's called a rib dib, is because disability takes 6 to 9 months if you're lucky to get a decision. Some people can't wait that long, so they file for retirement benefits and get their retirement benefit check started while they're waiting for their disability check to be approved. But with the understanding that if your disability benefit is approved, depending on the onset date when they determine you became disabled, it might be reduced because you took retirement benefits for, X amount of months. So, but some people need that money coming in. So they say, well, yeah, whatever. I need that money. Husband retires next year. Should he stay on benefits from his job, or does he need to be on Medicare? Um, yeah, if he is no longer receiving health insurance from work, then if he doesn't sign up for Medicare and decides to do it later, then he's going to be penalized 10% for every 12-month period he did not sign up for Part B. Because if he retires and that's, his health insurance is a retirement health insurance, that does not count. It has to be from current work, his or your current work. So if he retires this month and he continues to get his retirement health plan for a couple of years, and then something happens to that retirement health plan and he decides to go ahead and get, Part A, Part B, he'll be penalized 20% for the rest of his life. It'll never, ever end. Do you receive the COLAs on survivor benefits once you're 62? Everybody, once COLAs are calculated are determined by the Department of Labor Statistics in October, then they are automatically given to 70 million Americans on all forms of Social Security. Hi, was just approved for SSDI. Will I have Medicare or Medicaid? Well, you could have both, but in terms of SSDI, you will have Medicare if they determine your onset date is, your start date of your benefits are 2 years ago, then you'll automatically get Medicare. And then you just need to find a plan to cover all those gaps, because Medicare Part A covers your hospitals, Part B covers your doctors, but there are a lot of financial gaps in there that you are responsible for. The biggest one is Part B, that 20%. So you have to pay 20% of, surgeries and outpatients and tests and stuff like that. So that's why people get either a Medicare supplement plan or a Medicare Advantage. If you're receiving disability, depending on your state, probably your only option is Medicare Advantage. So give me a call, leave your name, phone number, state, and tell me that you're going to start Medicare soon, or email me, tell me the same thing, and I'll have one of my people that works your state call you up and give you all your options, and that is completely free. And full disclosure, if you like what they recommend and you enroll, then that helps this channel. So can I get married if I'm on X's survivor benefits? He retired 63 and me 62. Will as SS continue my benefits? All right. So yeah, you can get remarried after 60 years old. If your benefits won't stop. I'm on SSDI and a Medicare Advantage plan and want to keep the Medicare Advantage plan after I turn 65 for 1 year to save on premiums. I think I can go on to a supplement plan before the year is up without underwriting. No, no. Some people do that because you have that trial right in the first year to check out a Medicare Advantage, and yeah, some people do that. So there's that. 124 watching, 60 likes. Please click the thumbs up for actually he's doing all a huge service. All right, just Jeff. Thanks for looking out. Yeah, I can't see how many people like on this little system here. Is that $2,500 per year a month or to collect my husband's survive? Not sure. 2,500. Oh, I think there's some internet BS myth going out there about more $2,500 coming or something. Yeah, I'm doing another video on all of the. I think I'll do a weekly video on all the hype and clickbait and BS out there, all the stuff. So keep you all safe. Is there an age where I can make any amount and it won't affect my CIS. um, if you mean retirement benefits, survivor benefits, spouse benefits, yeah, you're full retirement age. If you mean SSI, then no, it will always affect because that's a welfare-based program. Do royalty payments count as income when it comes to SSDI? Also, sales from art sales on Etsy. The royalty payments, no, usually because you did work, possibly before you became disabled. So that's there's royalty payments coming. But the computer system, the Social Security computer system, doesn't recognize that. So you'll probably get dinged, and you just go down there and say, "Oh yeah, this is royalty payments for some movie I was in 10, 20 years ago." Art sales on Etsy. If that's your business, then net income from business. If you're making a bunch of money selling art, and now you're an art dealer or an artist, then that's your business, and therefore, yes, that will affect because you are working. That's work. But if you just do it, just every now and then or something like that. So, yeah. I used to have an art gallery in Tokyo, so I was in the art world. There's usually, yeah, sometimes it's a bust or boom. If I go on disability at 62, would I get the full amount that I would have gotten at 65? No, you would have gotten the full amount you would have gotten at your full retirement age. 65 is not your full retirement age, but yeah, I see where you're going there. Yes. Yeah, disability is basically your PIA, your primary insurance amount. Your primary insurance amount is how much you would receive at your full retirement age. Nobody's full retirement age at 65 anymore. Now it's 66 and 8 months or 67 or whatever the case may be. Yep, you get your full benefit amount. Medicare, but you will have to wait unless backdated 2 years or yes, that is correct. There is so much garbage clickbait on in there. Oh my gosh, there's channels out there. That's all they do every single day. More money coming next one, and then you sit there for 5 minutes and they say, well, if this legislation that this one guy from North Dakota proposed in 1983 would have passed, you would have received an extra $2,500. And there you've already been sucked in for 5 minutes and watched all the commercials, and they got all the money. And so, yeah. You're appreciated very much. I have a big family and will gladly send your way. Thank you again. You're welcome, Brenda. Thank you. I appreciate it. Nothing better than a referral to other family members. That means you're doing something right. I'm doing something right. At what point did Congress decide all the money we had been paying for Social Security could be used elsewhere? Hasn't been used ever elsewhere. Check it comes out every month. The Social Security trustees report. Every penny down to the penny is allocated and accounted for. So none of the Social Security money has been used anywhere else. So it's easy to check that. Just go into the Social Security's monthly trustees report, and you'll see exactly where every penny is, and it's all there, present and or accounted for, as we used to say in the Marine Corps. But that's another internet myth that likes to go out there. I think that's perpetuated by Wall Street, because they want that money. So they're trying to put, doubt into your minds. So you just said, forget about it. It's all politicians steal it anyway, and this and that. And so when, the Wall Street billionaires and their, bought politicians come down and their, shining white horse and say, well, just give it to us and we'll save it. Yeah. Heads we win, tails you lose type of thing, right? Like, wasn't the whole idea of Social Security be a separate fund? Yes, it is a separate fund. So, yep, it's SSI welfare program. Once you filed, is 923 given immediately? Yeah, 943 for SSI. And you hear all the time that people want to cut Social Security even more. Yes, that's definitely one thing that politicians want to do, raise the retirement age, which is like the worst idea. All right, let's see. Looking to retire this year, when do I need to start the process for Medicare and drug plan? So, if sounds like you're already past your 65th birthday and you've been working, and you've been receiving health insurance from work, are my close on all my guesstimates? So if that's the case, then a couple of 3 months before, what you'll need if you're past your 65th birthday then you get a special enrollment period. No penalty. Don't worry about it. You'll just need a 40B and a 564, two forms. You fill those out. One of those you take down to your HR. They fill it out and say, don't penalize this person. They've had health insurance through the 65 since they were 65, and they sign off on it. And you just submit that to Social Security, and they start your Part B, and no problem. And about the same time, then you find a broker you know and trust, or you email me, and I can find someone in your area, and they can go through all your options. Medicare supplement, give you some quotes from the best companies. If you're looking for Medicare Advantage, they'll check your doctors and your prescriptions and all that kind of good stuff and find the best plan for you. Will my location matter to receive your personal services? I'm in the New York City. Nope, yep, no problem. Yeah, for me, it's just little old me. I haven't been able to find another Social Security expert in retirement that wants to talk about Social Security. They've already done it for decades while they worked, and nobody wants to do it again. I'm the only one. Yeah, I think my mother dropped me on the head too many times when I was a child, but yeah, here I am. But in terms of Medicare, I've got a team that can help you out with Medicare. They don't know Social Security. Nobody that does Medicare knows Social Security. A lot of people, they get this cute little certificate after 2 days of training, and they just go out there and they lose so many people money because they give out wrong information. So yeah, I've got people that can help you with Medicare Advantage, Medicare supplements, and they can do all 50 states. So no problem. And as I said, I've also got, if you're going to be retiring early and you're not going to get Medicare for a year, 2 years, 3 years, then I've also put together a team for the Affordable Care Act, Obamacare, and they can help you out in all 50 states. So I have a lot of fake clickbait channels I reported. Awesome. Does Social Security investigate those on Social Security disability at the age of 62? I mean, investigate, if you get earnings, yeah, there's a bunch of, lawyers and stuff out there that, YouTube channels that do a lot of fear mongering. Come on, Social Security can't even pick up the phones, and, they're not going to be out there with their black helicopters. If Social Security sees, that your, IRS reports to them that you made a bunch of money on SSDI, then, the letters go out automatic. If your next door neighbor calls and drops the dime on you, or your ex-boyfriend or girlfriend or whatever drops the dime on you, again, in my office, we're the busiest in the country, and we had 3 OIG agents that worked down the street. And yeah, they were booked up all the time. They used to get calls like that all the time. And if it was not, I mean, really, really in your face egregious, then, they had, other places to go, did bodies in 55-gallon drums, still collecting checks because of the kid. Yeah. So yeah, all kinds of, I could spend hours with all the interesting cases. All right, let's see, 68 this month. All right. Happy birthday. Let's see. Gwenda, after 6 years on SSI contacted me on 64 and transferred me to survivors after learning my ex passed. Up to now, I was on Medicaid. Am I eligible for Medicare now? I will be 65 in April. Yes. So yeah, if you're on SSI, anytime you're eligible for any other benefits out there, retirement benefits on your own at 62, so it sounds like your ex's benefit amount wasn't high enough when they were alive, but when they passed, then you got some extra money. So yes, and now that you are receiving, retirement spouse survivor benefits, then that means you are eligible for Medicare. Yeah, so you should be getting Medicare pretty darn soon. It's April, because that was what, 2 months ago. So now you have to start figuring out, if you're on SSI, you should also be on Medicaid. So you can have Medicaid and Medicare, and depending what level of Medicaid you have, you can also get what's called a dual eligible plan. Dual because you're on Medicare and Medicaid, and those are the ones that a lot of people want because they have all the extra benefits. So send me an email, and I'll have someone go and they can check to see if your Medicare, has been activated, and they can see what kind of level of Medicaid you're in to see what is available in your particular area, and they will give you your options and you decide what you want to do. Does a wife collect Social Security from divorced husband if she marries again? Um, no. Yeah, your benefits essentially stop. Ed, when did you serve in the Marines? 19, got my Marine Cup there, 1982 to 1990. El Toro, Okinawa, Camp Smith, Kaneohe Bay, Camp Kinzer, Camp Foster, Camp Zuccotti. Yeah, so all those. Does the driving spouse get the full amount of the deceased partner? Does the current spouse get the full benefit amount of the deceased partner? It depends if he or she is for retirement, full retirement age, then yes, get the full amount. Yes. All right, we are at an hour, and I think we did pretty good for the questions. And I appreciate y'all for subscribing and liking and all that kind of good stuff, so we can get more information out there. And next week, I'll do another 3 things that people are making mistakes and losing money. So let's get that money out there to people. All right, y'all.